I'm going to describe a classroom experiment that I use to give students an intuition for adverse selection in health insurance. This is one of my favorite days of the whole school year because students actually get to see the market unraveling. They get to make their own decisions about buying health insurance, and then we enter those decisions into the market, and they watch as the market unravels, as the price of good quality insurance goes up, as the price of bad quality insurance goes down, and they see how unfair this is for people who are really sick. So if you stop at the end of the experiment and just look at the faces across your classroom, you're going to see faces that are just totally in shock, like jaws on the ground. And I love that because that really gets them ready for the lecture I give after that. And you also just get to say, yeah, adverse selection matters a lot in health insurance. So in this video, I'm going to explain that process. This is also an article that I published in the Journal of Economic Education, so I'll put a link to that below. And I'll also put a link to my GitHub where you can get the materials that I use for this experiment, so that all you have to do is print out some character slips and prepare to use the Excel. So an overview is they come into the classroom, they are asked to come up with a budget, a monthly budget for an income that's roughly at the 40th percentile of incomes. So not too poor, but someone who has to really think about their budget. Then they're given a character slip, and that character has some kind of illness or no illness, and they have risks of going to the hospital. They can look at those risks, different for every student. And then they're asked to make a decision about what health insurance to buy from 3 options: gold, silver, and bronze. And they adjust their budgets to include that health insurance. And of course, the people with sicker characters are going to want the higher quality health insurance. The people with healthier characters are going to be fine with the bronze insurance. That's going to happen naturally. And then I pull up an Excel sheet that has the actuarially fair insurance prices that I've just shown them. And we sort of talk about actuarially fair values. We talk about the fact that this situation is 3 insurance companies that are all not for profit. So profit is not going to drive what they're going to see happen in the market. And I get to the point where they understand the spreadsheet enough to figure out what's going on in the experiment. Then after they've made their decisions, we enter everybody's decision into the spreadsheet. And the actuarially fair prices are going to adjust as we enter people's values because, of course, I came up with these actuarially fair values assuming everybody would select in. So when we put the actual people who selected gold, silver, and bronze, those prices are going to have to adjust according to the risk level of the people who selected into the pool. And of course, it's very climatic because they're watching the price go up as I enter people's decisions, and the very last decision is the very sickest person, so that decision sort of drives prices way up, and they're just watching these prices, seeing how the market can unravel. And it's so great because when they're in that state of shock, they are so ready to hear what you have to say next about adverse selection, about markets unraveling, race you to the bottom. These concepts that are really important for health insurance, they are just primed to understand that. So this is a really fun experiment whenever you're teaching adverse selection. To any class, really, and microeconomic theory works really well for, obviously, healthcare economics. I think it would work fine for principles of economics as well. All right, now I'm going to go through and describe the process in a little bit more detail. So the first thing that happens when they come into the classroom is that they see an annual salary and a monthly salary and an after-tax salary. And they're asked to come up with a budget from scratch. Now, why is this step necessary? It's necessary because there needs to be a cost to selecting the higher quality insurance. If you do the experiment without starting out and forcing them to budget, then everybody's just going to be like, oh yeah, just buy the gold insurance. It's a little bit more, but of course it's worth that much more. So they actually need to feel that cost. They need to realize, oh, if I choose the more expensive insurance, then I have to adjust my budget and spend less on transportation or less on entertainment. So the budgeting is necessary. But I will say the budgeting is actually kind of fun because with undergraduate students, some of them have never done a budget before. This is just a totally new thing for them, that they're given a monthly after-tax amount and they have to come up with from scratch with what are the line items? How much does housing cost? How much does food cost? What is a reasonable amount? And my students are in groups, so they're asking each other these questions, like, how much would I need to put down for a mortgage or for rent? And they fill in each other with some reasonable amounts. But that's just sort of a fun process, and a process that probably students should do at some point in their 4 years of college, especially econ majors. So even though this takes a little bit of time, I think it's worth it and it's necessary for the experiment. Now, I usually choose a dollar amount for their income that is about at the 40th percentile. And the reason I do that is because this can't be people who are low enough income that they qualify for government Medicaid. That wouldn't work. I want them to understand that this is actually just regular insurance in the United States. And of course, if it's too high, then insurance is not a big deal. And of course, they can adjust their entertainment budget because it was high to begin with. So I find that the 40th percentile of the income distribution is about right. Now, after I've talked to the class about how much are you budgeting for food, what are you including, did you include any for savings, what about paying off your student loans, I have that conversation with the class. Then I ask, how much did you budget for health insurance? And maybe some of them will be like, oh, health insurance, I forgot that. And others, especially if it's healthcare econ and they kind of have a sense for where this is going, have a number that is oftentimes way under what it costs to actually buy health insurance. So it can be nice at this point to sort of show some figures. If you were buying health insurance from the exchanges on your own, this is what you would pay per month. And usually they're pretty shocked by how much it costs. Now while they're doing that, I hand out slips of paper with a character. And the character literally just says, this is your age, this is any illnesses you have or don't have, and what is your risk of a major illness and a minor illness. Now, the character slips that you hand out to students are one tab of this spreadsheet. So the morning of the experiment, I just go in and I print these out and cut them up so that each student has one little sliver of paper. So after we've done these budgets, I explain what a major illness and a minor illness is. Major illness costs $200,000, so this would be like you get cancer. Minor illness might require a few trips to the emergency room or being under a doctor's care for 4 months or 6 months. And they just have probabilities of needing those two types of care. Now, the characters are distributed in a way that is roughly equal to the distribution of healthcare needs in the population. So this graph shows a distribution of healthcare spending in the United States. And this has been fairly stable over time, where the top 5% of spenders, that is the sickest 5% of the population, spends about half of healthcare dollars. And the healthiest 50% of the population spends about 3% of the total healthcare spending in the United States. The character slips that I hand out to them matches up with this distribution. Now, the gold, silver, and bronze plans are the 3 options they have. And at this point, you might talk about the health insurance exchanges in the United States and how that works if you're buying health insurance for yourself. Actually, there's 4 categories. There's also platinum, on the real exchanges, but I find it simplest just to have 3 options. You probably also need to make sure they know what a deductible and copay is, because many students don't. So talking that through, helping them think about how do you make this decision is part of what you're doing. And I usually tell them, okay, make a decision, write it down, and show somebody next to you. The key thing that does is it stops them from changing their decision in the middle of the experiment. You definitely don't want that. You want their decision locked in with the prices that you give them at the beginning. All right, so they've written down a decision. The next step is to show them this spreadsheet. Now, the spreadsheet looks kind of complicated. The main thing this spreadsheet is doing is showing them actuarially fair prices for insurance. What this means is if insurance companies charged these prices at the top here, then they would break even. They would not be making any profit. They would not be paying any employees of the insurance company. This is just the cost of covering people's care, covering people's hospital visits and doctor's visits. So it's important to emphasize that the 3 insurance companies in our experiment are all not-for-profit, and they're zero profit, and they're also zero overhead. Because sometimes students will think that this phenomenon is driven by profit maximizing, and as a matter of fact, it's not. In fact, Germany does not allow for-profit insurance companies. All of their sickness funds are not-for-profit, and yet they still have adverse selection in Germany. So at this point, you explain the worksheet, you explain how you came up with these numbers for pricing the insurance, that it's just the numbers they need to break even. And you also mention that you're assuming that everybody selects into every plan. So the silver plan, those people figured everybody is selecting into the silver. I'm pricing it as if everybody is selecting in. And you might talk a little bit about why is the expected cost of care so low for these healthy people and so high for the student who has cancer. And of course, you're focused on the top line of this spreadsheet, which is the pricing. These numbers should match up to the prices they were just looking at when they made their decision about bronze, silver, or gold. The next step is to actually do the market. This basically means entering the decisions they've already made. As the professor, you call out character number 1. What was your decision? And that person says, okay, bronze. I chose the bronze plan. At that point, you delete the silver number and the gold number from the spreadsheet. Then you go on to character number 2, and you're basically going to ask for every student's decision. Oh, and by the way, if you don't have exactly 30 students, that's fine. You can either have a student make a decision for 2 characters, or if you have more than 30 students, you can pair them up. But in any case, after you've entered 2 or 3 of the decisions, you can ask what is happening to the prices and why. And this is sort of you checking to make sure they understand how the spreadsheet works. But it's also sort of them beginning to see what's going on with adverse selection. Generally, what happens is the first 3 people choose either silver or bronze, and probably bronze. So you've deleted those characters' entries from the gold and silver plans. As a result, the price of the gold and silver plans would need to go up if the company were going to break even. And you can ask the students at that point to explain why. And of course, the reason is there's fewer healthy people to spread the costs of the sick people. So once they kind of have an intuition for that, then you move on and you say, watch those prices as we enter the decisions you've already made. And you go through one by one asking the student, what did they choose? Deleting the options they didn't choose. And they're going to watch the price of bronze go way down and the price of gold go way up. They're just going to watch this happen. Now, you might be worried, what if they don't make good decisions? And I will say, this experiment should work basically as long as the sickest person, the sickest character, chooses gold. Which really, they should choose gold. I've actually never had a situation where the sickest character does not choose gold. But if you did, you could always be like, how did you make that decision? what would other people decide, and sort of get at the right situation based on the actual rational thing for the sickest player to do. Because the sickest player has an 80% chance of needing care. So they should want no deductible and no copay, no matter what. Now, once you've entered everything, they're usually sitting there. That's the point at which they're just shocked. They've just seen something happen that is blowing their minds, and they're trying to wrap their minds around it. Adverse selection is a challenging concept, so I give that a moment where I just look at the class and watch them process what they've just seen. And at that point, you can start talking about it. What happened? Why did it happen? And of course, they're concerned, like everybody who bought the gold insurance, if the company were to price that gold insurance appropriately the next year, the price would be so high that those people probably could not afford it based on that 40th percentile income. In fact, you can ask the students, what would happen if we redid the experiment with these new prices? And they'll all be like, oh yeah, everybody will pick the bronze, except maybe the sickest person. So they understand that this market would collapse down to bronze. And they'll probably ask, do you have to buy insurance when you start talking about the market collapsing to bronze? And then you can talk about the mandate and whatever you want. It's a fun conversation. Now, at this point, they are very ready to hear your lecture on adverse selection and health insurance. Here's some things to cover in the lecture after this. Obviously, you want to talk about how this was driven by the fact that sick people selected into the gold plan, and because there were not that many healthy people selecting that plan, that drove the price of it up. If the company just wanted to cover its costs, it's just really expensive to cover the group who selected into gold. And the reverse was true with bronze. Everybody who selected into bronze was relatively healthy, so you didn't have many healthcare expenses to spread across that group. At this point, showing this diagram of the distribution of health spending across the population and how their class matched that distribution in this experiment, that's really important because this distribution is driving adverse selection in health insurance. And you might even talk about how other industries don't have as dramatic a distribution. Like car insurance is not going to be nearly as dramatic as health insurance in terms of this diagram. This diagram would look totally different for car insurance. And you can think through that with students. You want to talk about the concept of the death spiral, which is exactly this process. It's where the price of high quality insurance goes up, the price of low quality insurance goes down. That causes people to move away from the high quality insurance toward the low quality insurance. And if you iterate this process, things will collapse toward the lowest quality plan. That's the death spiral. You can also talk about race you to the bottom. Normally in economics, we have companies competing to see which can provide the highest quality product to attract more people and win the market. In this case, the winner is actually who provides a low enough quality product to keep the sickest group out, because the sickest people know the quality of their insurance. Healthy people have no idea how much red tape there is, how many restrictions there are. So this gets at race you to the bottom. This is also a good time to talk about financial and non-financial dimensions of quality, where financial dimensions of quality are just deductibles and copays. Those are the easy things to work with. Non-financial dimensions of quality, which usually I will ask the students to come up with these. What is a non-financial dimension of quality? It includes red tape. It includes what procedures are covered. It includes what doctors are in the network. It includes what hospitals are in the network. There's all kinds of things that are non-financial dimensions, and really sick people tend to be very familiar with the non-financial dimensions of quality. They care a lot about that. You also want to re-emphasize that this experiment was with not-for-profit companies. This is not driven by profit. If you're going to bring in some literature, Cutler and Rubber is a great paper, and I'm not going to explain that here, but I'll put a link to the paper below. The basic idea with Cutler and Rubber is that Harvard had one single health insurance plan or one single company covering their whole population of professors and janitors and everybody who worked for Harvard. And then they switched suddenly to a voucher-based system where each person got to decide which company to go with. And they documented adverse selection in a way that matches up with this experiment pretty well. So it's a good time to talk about that paper. And finally, you want to give them a little bit of hope because it is a little bit of a depressing thing to come to understand for the first time. So the main two solutions to adverse selection are eliminating competition and adjusting for risk. And eliminating competition is not just single-payer systems. It also includes large employers. Even if large employers offer 3 types of health insurance, usually they're with the same company, so they can cross-subsidize across those different plans. So that's basically one version of eliminating competition to avoid the adverse selection problem. And then risk adjustment is another factor. I'm not going to go into that a lot in this video, but basically, there are some problems with risk adjustment. It's really hard to be perfect in risk adjustment, but that's what Germany does. That's what the health insurance exchanges do in the United States. And Medicare Advantage, which is also a voucher-like system, adjusts for risk.